Knock knock.
Mm-hmm.
Hey, Mr. Freeman, how are you?
I'm doing fine.
Good. My name is Anna. I'm going to be your nurse today, and I'm going to be doing a full head-to-toe assessment on you. It's going to require some movement, some touching, and it's going to take about 20 to 30 minutes. Is that okay?
Mm-hmm.
Okay. I'm going to close this curtain. I'm going to wash my hands, get some gloves on, and then we'll get started. Okay, first I'm going to check your wristband and just make sure that I'm doing the assessment on the right person. What's your name?
Charlie Freeman.
Okay, do you know what today's date is?
September 26th.
Okay, do you know where you are?
Hospital.
Okay, do you know what you're here for?
Yes.
Okay, and what is that?
Physical.
Okay, patient is alert and oriented times 4. Okay, so now at this point, I will get your vital signs, your blood pressure. I will be checking for pulse. I will be checking for heart rate. I will be checking for pulse oximetry. I will be checking for respirations and also pain. Are you in any pain right now?
No.
No pain. So on a scale of 0 to 10, what would your score be?
0.
Okay, no pain zone today. Great. Okay, so we're gonna move along. I'm gonna go ahead and inspect your head, your skull, and your hair. Can you lean forward for me? Okay. Okay, in the skull, no lumps, bumps, or bruises or lesions noted. Hair is clean and intact. No lice noted. Okay. I'm gonna check your temporal artery, palpate. No pulsations. Okay, I'm gonna come down and check for TMJ. Can you smile for me? Can you frown? Can you open your mouth? Can you close your mouth? Can you clench your teeth? Give me a good cough. Okay. No TMJ noted. Cranial nerve 5 and 7 are intact. Okay, so now I'm going to check for your checking your eyes. Okay. Sclera is nice and white. Conjunctivate is nice and pink. Okay, I'm going to check for symmetry of your pupils, okay? Okay, can you gaze in on the pen? Okay, pupils constrict as I go in, dilate as I come out, okay? Pupils are round and even. Okay, I'm gonna check the 6 cardinal gazes. That's cranial nerve 3, 4, and 6. Follow my pen. Okay, cardinal gazes are intact. I'm gonna go ahead and check. Well, at this point, I would have you read from the Snellen eye chart. I would have you step over there about 20 feet away and try to read. I'm sorry, not feet, maybe steps, 20 steps, and feet and read off of the Snellen eye chart at this moment. So now I'm gonna go ahead and check the corneal light reflex. So I'm gonna look in your eyes. I can see the light in your eyes. Corneal light reflex is intact. And now I'm going to check your ears. So, okay. Ear canal is intact. There's no drainage, no redness, inflammation noted. Tympanic is a pearly gray, as it should be, no bulging on the inside. So I'm gonna come behind you, and I want you to repeat what I say to you.
Light type dynamite.
Good. Okay, awesome. That's cranial nerve 12 is intact. So now I'm gonna check your nose. Okay, no septal deviation noted. Nose is symmetrical, okay? And your face is symmetrical. Cranial nerve 5 is intact. I'm gonna test for your nose. Hold, take one of your fingers and place it over one nostril and blow. Okay, the other side, please. Okay, patency of nose is intact. And now I'm gonna check your maxillary sinuses. I'm gonna palpate. Any pain or pressure?
Mm-hmm.
Any pain or pressure?
Mm-hmm.
Okay, good. Okay, so now I'm gonna come down and can you turn your head to the side? Okay, inspecting and palpating for any JVD, no JVD noted. Okay, Gonna check for resistance. Can you press your, okay, the other side. All right. Can you turn your head to the side, to the other side? Can you take your ear to your shoulder? Ear to your shoulder. Good. Okay. Can you, I'm pressing down and you go, okay. Cranial nerve 11 is intact. I'm gonna check your carotid pulse. And I would do this one side at a time for 1 minute. Okay. All right. And at this moment, I would check your trachea. Trachea is midline. Thyroids are non-tender. No pain noted. Can you turn around for me? I will come behind and do the same to palpate the trachea. Can you give me a swallow? Okay, swallow and gag reflexes are intact. Okay, and so now I've checked the range of motion of your neck. And at this moment, I would have you smell something, maybe like coffee or peppermint or something like that at this moment to test cranial nerve 1 at this moment. And then I've had you shrug your shoulders, and I'm gonna check your skin tugger while I'm up here. Okay, skin tugger is +2. And then I'm gonna check your arms. Let me check your arms. Hold your arms out for me. Arms are symmetrical. Pronation and sulfonate, can you do this? And sulfonation are intact. Skin is intact with no lumps, bruises, or lesions noted. Okay, I'm gonna come down here and check your hands. No clubbing noted. In your hands, capillary refill is 3 seconds. And I'm gonna check your epitrocular nodes to make sure that there's no inflammation. I would do this on both sides. No inflammation or infection brewing up. I think I've gotten everything as far as the hands is concerned before I have you lie down. Okay, so go ahead and lie down for me. Okay. Okay, at this point, I would go ahead, I've already checked your skin tugger. I will go ahead and listen for long sounds. Okay, I'm gonna go ahead and listen for heart location sounds. Abdomen, aortic, pulmonic, Erb's point, tricuspid, mitral valve. Then I will locate the PMI and the apical pulse, which I would listen for 1 full minute. Okay, I'm gonna go ahead and listen for vascular sounds as well. My triangle. Listening for the iliac, the inguinal, and the femoral. Okay. So now I'm going to go ahead and listen to the bowel sounds, which I would start in the right lower quadrant. In each quadrant, I would listen for 1 full minute. Good. Bowel sounds are hyperactive. If they weren't, then I would repeat that and listen for 5 minutes in each quadrant. Okay, now I'm going to percuss. Any pain, any discomfort? Okay. Okay. So now I'm going to light palpate. Any pain? No pain, discomfort. Okay, I'm going to deep palpate now. then I'm gonna do a quick press and a slow press and quick release. And you let me know if you feel any pain. Okay, good, no pain. Okay, while I have you like this, I'm gonna go ahead and palpate your liver and your spleen. Liver would be over here on the right side. Any pain or tenderness? Okay, I'm gonna go over here and light palpate the spleen. Pain or tenderness? Okay, there's no bulging, no pain or tenderness over the spleen or the liver. Now I'm gonna palpate your kidneys. And I will do the same on the other side. Any pain or tenderness? Okay, good. Okay, now I will come down here to the legs and inspect the legs. On the legs, the skin is intact, appears to be intact. The hair is evenly distributed. There's no redness, no inflammation, no edema or heat to touch on the surface. So no DVT is noted. And then I'm gonna check for the pulses, the popliteal behind the knee on both sides. And I will also check for DVT on both sides. And then I would check for the dorsalis pedis, which is on top of the foot post, and the posterior tibia, which is behind the ankle. And I would do that for both sides as well. Okay. Can you point your toes? Okay, can you pull them back? Can you fold them inward? Okay, can you push against my hand? Okay, can you pull against? Okay, check for flexion and extension. Okay, can you raise your leg up? Okay, can you bend your knee? Okay, good. Flexion and extension intact. Can you fold your knee in? Checking for hip rotation and out frog-like manner. Okay, good. Okay. Okay. Can you can you rise up for me? Okay. Good. All right, at this point, I would check for reflexes in your knees, and because he is not sitting to where I can actually check them, but I would do this on both sides at this moment. And I will also check for reflex in the elbow as well on both sides. And then I'm gonna go ahead and I'm gonna have you to, that's what I'm gonna do. Okay. I'm gonna put this in your hand and I want you to tell me what it is. I want you to close your eyes. And you tell me what that is.
Begin.
Okay. And then I'm gonna write something in your hand and you tell me what it is.
8.
Okay, good. Okay, and so now I'm gonna do the 2-point, let me find my other pen. Do the 2-point touch. Keep your eyes closed. And I want you to tell me how many touches do you feel at one time?
2, 2, 2, 1.
Okay. 2-point touch is within normal limits. Now I'm gonna do the sharp to dull, and you tell me if you feel sharp or dull. Close your eyes.
Sharp. Tall. Sharp. Tall. Sharp. Dull.
Okay, good. Awesome. Okay. Sharp to dull test is within normal limits. So now I'm going to ask you to stand for me, please. Okay. And do a shallow bend for me. A loose squat. Good. Okay. Also hold your arms out. Okay, now I want you to close your eyes. Okay. So Romberg signs detected or noted. Now I need you to take your heel to shin And rub down one side and the other. Good. Okay, can you take a few steps that way? And then walk back for me. Steady gait is intact. Good. Then I'm going to drop this, and I want you to bend over for me and pick it up as I check your spine for curvation. Okay. Spine is intact. No scoliosis detected. Okay. Can you put your arms out and turn from side to side? I want to check the spine rotation. Okay. Can you bend from side to side? Okay. Awesome. Okay. Have a seat for me. And I want you to sit up a little bit, please. Okay, turn this way. Okay. And I'm gonna listen for lungs sounds back here as well. And what I want you to do, every time you feel my stethoscope, I want you to say 99.
99, 99, 99, 99, 99, 99, 99.
Okay, great. So now I want you to whisper. I shouldn't be able to hear you at all. Okay, good. Okay, now I want you to say E and hold it. Okay, sounds are diminished as I go down. Okay, so now what I want you to do is I'm going to palpate as you say 99 all the way down. You ready? Oh.
99, 99, 99, 99, 99.
Good. Okay. So then I'm going to check for the CVA in the mid back up under the 12th rib and check for pain. You let me know if you feel any pain. Any pain?
Mm-mm.
Any pain?
Mm-mm.
I would do that on both sides. Okay. Let's see. And curvation, I've checked for spine curvation.
Mm-hmm.
I want to make sure that I've covered everything. I believe that we have pretty much covered all that we need to do on today. I don't think I've missed anything. Check capillary refill, check legs, I've checked range of motion, and everything looks good. And that's a good thing.
Okay.
So, that'll be all for today, Mr. Freeman.
Okay.
I thank you for your time,
Thank you.
and the doctor will be in soon.
Okay, thank you.